Good morning, everyone. It's my pleasure to be invited today to this session to present my abstract during St. Gallen Breast Cancer Conference. Many thanks to the Value Journal of Oncology. My abstract named is Assessing the Impact of COVID-19 Outbreak on the Oncological Practice regarding metastatic breast cancer patients treated with CDK4/6 inhibitors. And first of all, I'd like to start with a brief talk on the global burden of the breast cancer. Unfortunately, the most frequent cancer in women. And actually, we have quite an important number of patients who are metastatic at diagnosis. So this leaves us with a big burden for patients who need our help in their fight against advanced breast cancer. And as we know that we are treating an incurable disease, so it's important to balance the treatment efficacy and toxicity. I also wanted to point out the importance of the biological subtype of the disease and how it affects the breast cancer survival. And as we know that the luminal A patients develop later metastasis, whereas the other, like triple negative or HER2 enriched, they develop much quicker metastasis. And currently, CDK4/6 inhibitors combined with the endocrine therapy is the standard of care for patients with ER positive, HER2 negative, since it achieves progression-free survival benefit. And also it increased the overall survival. And we know that from the survival data, from the major trials for the CDK4/6 inhibitors, either a Paloma 2 trial, Mona Lisa 2 trial, and Monarch 3 trial, and also the Mona Lisa 7 trials. So the CDK4/6 inhibitors can be combined with either AI or fulvestrant in de novo or recurrent advanced breast cancer in first or second line management. And this concept has been proven effective. So during COVID, actually our big challenge was, as we are in the middle of the pandemic and many countries will pass through raise in their cases, the cancer patients, when they got the COVID-19 disease, they are at more risk of having severe complications. And if we speak about the breast cancer care during COVID, and as we want to treat these patients according to what we think is the best possible scientific evidence, but in fact, we don't have much evidence regarding what we have to do during the pandemic. And actually, most of the results regarding the cancer and COVID-19 recommendations has very low evidence in the guidelines. And most of these recommendations are coming from the cancer societies regarding how to proceed during this pandemic. So I'd like to proceed with some recommendations which specifically was adopted by the ESMO during the COVID-19. First of all, for the vast majority of the ER positive, HER2 negative metastatic breast cancer patients, the endocrine-based therapy was recommended. And the most difficult decision was to add CDK4/6 inhibitors due to their immunosuppressive effects, despite their advantage. Also, the use of the CDK4/6 inhibitors, mainly the palbociclib, the ribociclib, and the abemaciclib, in this category of patients must be weighed against the increased risk of the adverse events. Also, the ESMO recommended the dose reduction that can minimize the treatment-related toxicities. I think most of us know that the main side effects, mainly for the palbociclib and ribociclib, is the neutropenia, which make the decision quite challenging. Also, the ESMO recommended the choice between postponing the incorporation of the CDK4/6 inhibitors in the first-line treatment for the patients who are presented by a special pattern of disease, like bone only disease, or low burden, or de novo metastatic disease, and mainly if these patients are elderly population. ESMO also recommended that the risk associated with neutropenia need close monitoring for the symptoms and to promptly withdraw the treatment if you suspect neutropenia in your patients. I also would mention the importance of the telemedicine, which was implemented during the COVID in monitoring for our patients. When we try to planned this study, we aimed to evaluate the adoption of these new guidelines for metastatic breast cancer patients who had been treated with CDK4/6 inhibitors. We have 45 patients were enrolled during this study, 45 patients with metastatic breast cancer during the period from 1st of June 2019 to 30th of June 2020. We assessed the toxicities, including either fatigue, diarrhea, sepsis, neutropenia, stomatitis, thrombocytopenia, nausea, vomiting, dyspepsia, and arthralgia. And we recorded the grades of the toxicity based on the common terminology criteria for the adverse events, the CTCAE version 4, which is mainly adopted by the NCI. We give our patients the options for treatment break, dose reduction, change to 3 monthly prescription, and also we assessed our patients clinically and radiologically with CT scans. In terms of the results, we have around 95% of our patients were females, 29 patients were on palbociclib, and 16 patients were on abemaciclib. 15 patients had started the treatment during the pandemic from the 1st of March to 30th of June 2020, and 3 of them aged above 75 years old. None of our patients tested positive for COVID-19 during that period. Around 13% of our patients had a treatment break during COVID pandemic. 8 patients had progressed. 8% of patients changed to 3 monthly prescription. 40% of our patients reported dose reduction. Out of these, around 33% had a dose reduction due to toxicities. Around 7 patients had toxicity which required admission. And fortunately, 57% of our patients continued the treatment without significant toxicities. In terms of the toxicities for the palbociclib, the main toxicities recorded were diarrhea, sepsis, AKI, fatigue, while the diarrhea was the main toxicity reported with the abemaciclib. We had 20 patients who reported peripheral neuropathy, and 12 patients had grade 1 to 2 thrombocytopenia. Unfortunately, 5 patients had severe events, and they sadly died, but we didn't record any COVID-19 related death. So to summarize, we concluded that the use of oral targeted agents, mainly CDK4/6 inhibitors, in ER-positive, HER2-negative metastatic breast cancer patients must be weighed against the increased risk of adverse events, and it's safe to be given during COVID-19 pandemic. And we recommended to continue that treatment in case of second wave of the COVID-19. Also, it's important to conclude that the dose reduction does not affect the efficacy of the CDK4/6.